Thank you, Acting Speaker. I rise today to contribute to the Public Health and Wellbeing Amendment Pandemic Management Bill 2021. And this bill seeks to amend the Public Health and Wellbeing Act 2008 to insert a new part to provide a targeted framework for government action to keep Victorians safe in pandemics. This includes the provision for the ongoing management of the COVID-19 pandemic following the expiry of the state of emergency. It will not only ensure Victoria can continue its effective management of the COVID-19 pandemic after the state of emergency expires on December 15, but also that Victoria has fit-for-purpose legislation to implement crucial public health measures in the event of any future pandemics, and let's hope that that never ever occurs, of having any future pandemics. Managing pandemics through dedicated provisions will mean there is a legislative framework that recognises that. Unlike some other types of emergency, pandemics often pose an ongoing threat over a period of months, and as we've experienced over years. The bill enhances the state of emergency model with improved powers to gather and share information, legislative safeguards to protect contact tracing information, and new accountability, transparency and review mechanisms. This transparency is what others have been calling for some time. And look, I want to thank the Minister for Health for his work on this bill, and I notice that he's at the table here today. Of course, the essence of this bill seeks to allow the government to manage pandemics effectively and begin the road to recovery for Victoria sooner. As Victoria emerges from lockdown and seeks to recover, we have talked about the amazing events and upcoming attractions, be it the Moulin Rouge production, the Australian Open or the Formula One. But here we are this week, all taken by disbelief by a surprise event. We have the Liberal National Party Circus du Soleil, the backflips and the mental gymnastics of the opposition. What an amazing example of psychological contortionism those opposite have performed recently on this issue. We see in an article on the 9th of October 2021 in The Age, I quote, Opposition Leader Matthew Guy agrees. He says, "The government, not public servants, should take responsibility for managing the pandemic. Those who make these decisions, politicians, should be ultimately accountable for them." Mr Guy said this week, as a general principle, I think public health orders should be ticked off by a minister or the Premier. When it's a minister or a politician, we are responsible and we are accountable to the people. And I think during a pandemic, making legislation that is so wide-reaching, they should be accountable, and those decisions should be accountable to the people. Sounds like to me he agrees with the legislation. And now this week we hear of the acrobatic feats where, now suddenly, they don't agree with their own musings. While opposition parties Australia-wide have worked in a bipartisan approach to fight this pandemic, we have now got a clear evidence that those opposite are just playing politics. And like all circus performances, at some stage, you bring out the clowns. And I refer to the Shadow Attorney General, where he couldn't articulate his own arguments about wanting to follow the New South Wales model when questioned on ABC radio. And that was yesterday with Virginia Trioli. What an enlightening interview that was. It was all buts and ums. It was one thing to be not across your portfolio, but it's a problem that you can't even explain your own ideas and arguments. The Chief Health Officer last briefed non-government MPs on the State of Emergency Declaration on its report on the 21st of July this year. Despite their interest, it's my understanding that neither the Shadow Minister for Health or the Leader of the Opposition have never requested a briefing on that state of emergency or public health orders. Acting Speaker, it's this government that get on and delivers for Victoria. And I should say first and foremost, this bill is about saving Victorian lives during pandemics. It's also about promoting and protecting the social, economic and mental welfare of Victorians to the greatest extent possible. We all know that Victorians have sacrificed so much over the last 21 months to get us to this point where we can reopen safely. And this Friday can't come quick enough for all Victorians. To manage the pandemic and keep Victoria safe, the state of emergency powers have been essential. and those powers are set to expire on December 15. When we extended these through the Parliament back in March, the government committed to reviewing the arrangements and bringing legislation to the Parliament to support the ongoing response to the pandemic. That's what we have here before us today. So this government listens and learns as well as delivers, and we have the ability to learn, not just criticise. The government has looked at the New Zealand model for how their arrangements have supported their very successful ongoing response to COVID-19. Their lockdowns provided them with freedoms that were unseen anywhere else in the world until the Delta variant escaped into their community from New South Wales. Of course, in New South Wales, the Minister for Health has very broad powers to take any action and give directions necessary to deal with the risk and consequences of COVID. This does not require a declaration of state of emergency or similar order to enliven these powers. We are applying these lessons to manage pandemics in the longer term, while maintaining our ability to rapidly respond to the current pandemic, including continued quarantining of international arrivals, requirements to be vaccinated, requirements to test and isolate for confirmed cases. And our current framework has allowed us to mount a world-class response to the COVID-19 pandemic. But as we move to the next stage of ongoing management on the pandemic, new arrangements will support the best and most transparent community response. So under Victoria's updated pandemic management framework, elected officials will be accountable decision makers, with the role of the Chief Health Officer remaining central to all key decisions. So in addition, the range of transparency and accountability measures being introduced through this Act as a strong check and balances on government's use of pandemic powers. Public health orders will be made by the Minister for Health, who is accountable to Parliament. Public health advice on the pandemic orders will be tabled in Parliament, and a new independent advisory committee that will review the public health orders and report to Parliament. SARC has the ability to review public health orders. The Minister will be required to publish an explanation on any charter rights that are or may be limited to a pandemic order. Acting Speaker, there is no other Australian state or territory equivalent legislation that requires this level of transparency and accountability. This framework will replace the current system, where state of emergency powers must be renewed every 4 weeks, up to a maximum of only 6 to 9 months. An independent pandemic management advisory committee made up of experts and community representatives will be established to advise on the pandemic response and management powers. A statement of reasons for the decision to make pandemic orders, the chose advice and how each order affects human rights under the Charter of Human Rights and Responsibilities must be published within 14 days. And any advice of the new Independent Pandemic Management Advisory Committee will be tabled in Parliament. The Leader of the Opposition will be pleased that this government, the Andrews Labor government, agrees with his comments on the 9th of October. Under this new part of the Public Health and Wellbeing Act, the Minister for Health will have the power to make pandemic orders if needed. And as the Premier has said, we have consulted leaders in the public health, human rights, law and policy making, as well as culturally and linguistically diverse community groups and the public housing and social service sector to ensure this legislation will meet Victoria's needs well into the future. Acting Speaker, as we get on and deliver for and protect Victorians, these amendments allow us to continue to do just that. And again, I just want to send my thanks to our nurses, doctors, health professionals, paramedics, police, and all those that have been at the coalface to protect and provide for Victorians. I encourage those Victorians that are not vaccinated to go and get the jab. And by the end of this week, the Melton Vaccination Centre would have administered vaccines to 100,000 people. I want to thank all Victorians for their amazing effort to fight off this pandemic, and I know that we all look forward to getting the state back as one this Friday. I support these amendments and I commend this bill to the House.